I don't know how many people say they had fun going to the doctor, but we sure have. We have been traveling the world, and this past week in Fethiye, Turkey, we went and got our annual wellness check. What's that mean, and how much did it cost, and who did we see, and what happened? We're going to share all the details about our update, our health screening at our wellness check, and we're going to compare it to what we did 2 years ago in Kuala Lumpur, Malaysia, where we also got a big wellness check. So who are we?
Yeah, so I'm Steve. This is Chris. We are EatWalkLearn. We've been traveling the world for 3.5 years now. And 2 years ago, we were in Malaysia, and we specifically planned that trip to Kuala Lumpur to get some medical tourism, some things that we absolutely needed to do, but including a health wellness check. That was an amazing experience.
And you can watch that video up here.
Right, that we're going to tell you about. And now it's been almost 2 years. We wanted to do the same thing, and we chose Fethiye, Turkey for that particular purpose.
Yeah, but why are we traveling the world and getting medical care? Where are we from?
Well, we are from the United States. We are Americans. But we're not in the United States. So in order to get our wellness checks, we have got to be a little bit more creative. And what we've actually found was an amazing, better alternative.
I know any of you Americans, or those of you who know about American healthcare, you're probably rolling your eyes because you know getting a wellness check, sometimes it's very easy, but when we tell you what we got done and you think of getting it done in the US, your eyes will just roll in the back of your head and your head will explode thinking they saw 8 specialists and they only paid that amount and they got it done in a day. Like, that doesn't even exist in the US. So this is why we have found that getting these wellness checks as we go around the world is affordable, effective, efficient, and well-timed often.
Yeah.
So the reason why we went to Fethiye, Turkey, is because we wanted to go to a place for a month that was beautiful. It's on the beach. We had a nice flat downtown. It's really accessible. There's lots of really fun things to do here. We thought it'd be a great place to hang out and get our medical care. So that's why we picked Fethiye. And we also had been in the Fethiye expat group asking about different hospitals and so on. And they had recommended the private hospital here. There's a state-run hospital and a private hospital. They had recommended the private hospital as a good place to go. So that's where we started. We went to their website. We found the hospital's website. We found out all the information for foreign visitors or foreign travelers, I think is what they call them. And we saw the whole setup for how they manage international travelers and how they use translators and so on. And we thought that's what we want to go do. So off we went to the Fethiye hospital. Yeah, so we signed up. So we went into the hospital a couple days before just to make sure we knew where we were going and everything was all set and everything and so on. So the morning of our appointments, of course, we had to fast because we were having blood work. So we fasted. We arrived at the hospital at 8:15. Immediately, we met with our intake person. She took us over to the translator, and then the translator walked us to all the different departments all day long. So the first thing they did was draw the blood, and then we went and we proceeded to do a variety of tests and meet with 8 different specialists over a 7 or 8 hour period.
Yeah, it was an all-day event, and they also, I think it was about 10:30 in the morning. We got to stop. We got to go to the restaurant and have some breakfast.
They bought us breakfast for the morning.
And it was, really nice and relaxing. And we actually had like a guide, somebody who spoke very good English, a very pleasant gentleman who took us from place to place, mostly to coordinate the timing of all of these different visits that we had with the different doctors and the different specialists and the different tests that were being conducted, but also to be there as a translator.
Most of the technicians did not have a level of English that was communicated with us. And the doctors had a fairly good level of English, but when things got a little complicated, we did need to use the interpreter. So,
Right.
Okay, so as the day went on, we went to the ultrasound, and we went to the sonogram, and we went to the MRI, and we went to the blood drawer, and we went to the glucose tester, and we went to the mammogrammer, and all these things. And, because there's nothing more fun than the mammogram. Then as we went to each specialist, they had our results, and they would then process the results with us, and we'd have conversation,
Right.
and they would talk about any prescriptions that we needed. They would write the scripts right there, and we'd get through, and we'd have a healthy conversations with them. Any questions that we had were answered, and we just worked through that with each specialist.
Yeah, I'm going to talk about a couple of the ones because there were a couple that I think that were that were fun or that were interesting or something that we needed to do.
Fun is the right word.
It's like, well, we met with a neurologist. And,
Oh, yeah.
And I think that was kind of interesting because, I have concerns as I'm getting a little bit older, maybe getting a little bit forgetful. I've always been a little bit forgetful. And, and things like, anxiety or whatever as we're traveling, different pressures. But he was actually pretty funny. He stopped asking me questions and started asking Chris questions.
And he turned to me, he says, does he forget anything? I'm like, finally, I get revenge on my husband. But we found out that Steve is just Steve and that there's nothing wrong with his brain. So that was really good to really relieved a lot of anxiety that you had about that.
We did get a good report.
And then we had to go to the ophthalmologist. We'll follow up a little bit more about why we had to go there. But the same thing, they're like, asking me questions about can I see? And then finally they turn to Steve and they're like, what does she miss?
Yeah, she can't see. So
and he's like, revenge again. So anyway, but I found out that I'm fine too. So we'll get to that. Yeah. But anyway, so at the end of the day, we after we looked at all the results, we did have 2 referrals. They wanted Steve to go see another specialist and me to see a specialist. So the next day, we went back to see those specialists and got our diagnoses confirmed with those specialists.
Yeah. And then we went back to the original people. It was interesting because both of these situations were identified 2 years ago in Kuala Lumpur. Probably conditions that have existed for a while for us, even back when we were doing our health checkups regularly in the United States, were never discussed, were never,
never diagnosed.
Never diagnosed. Yeah. And now, 2 years ago, we get some initial consultation in Kuala Lumpur, things to look out for without getting into too many details. 2 years later, now we're in Turkey. We get all those things confirmed. And some additional tests to make sure that things are under control.
Yeah. I think it was, as we talk about what we've done, we've gotten some skeptics say, oh, well, you need to really worry about those, those tourist wellness checks because they're going to overdiagnose you and they're going to scare you into selling you more things. As Americans, we kind of we understand that philosophy because a lot of us are real skeptic about the American medical system and what things are recommended and when. So we were concerned about that. And when we went to KL, Kuala Lumpur, and Steve had to go see a specialist and I had to go see a specialist, at first we were a little bit like, are they just trying to push another $100 on us, to go see these specialists? And in both cases, the specialist told us we had a condition, but it didn't need to be treated yet. So then now 2 years later, we're in Fethiye. The exact same thing happened. In both cases, we were both told to go see the same specialist again. And in this case, both those specialists confirmed what had been talked about in KL and that they now need to be treated. So we had both worsened in our conditions. The difference between Kuala Lumpur and Fethiye is Fethiye, it seemed like we were kind of at a regional hospital, where in Kuala Lumpur, we were at a national hospital. So kind of a little bit, not apples to apples there, definitely different facilities. And Kuala Lumpur is a huge city. Right. It's like the New York of Asia, whereas Fethiye is just a regional beach town. So, so maybe in relation to medical quality or medical access or medical whatever, there might be some differences there just because of the size and locations of things.
Yeah.
Right.
Yeah.
Okay.
Yeah.
So in KL, we also did the same type of wellness test. We also saw the specialist say the same thing. The major difference, I think, between KL and Fethiye in relation to the doctors was in KL, we had a general practitioner that everything ran through, who gave us all our results and everything at the end of the day. Right. Versus in Fethiye, it was the specialist that gave us the results. That was the biggest difference between them.
Yeah.
Okay.
So I want to show a slide here of all the different specialists that we went to. And noted that I've got a column here for Kuala Lumpur and a column for Fethiye. And they vary a little bit in difference. And I went back to the website in Kuala Lumpur today. So I didn't take my data from 2 years ago. I went to what they're offering today to make sure that it was up to date on what they're offering currently. So these are apples to apples comparison, not comparing from 2 years ago.
Right. So I think the biggest difference for you was this time you got to see a urologist. Woohoo!
Yeah, in KL, I think it was like a general internal medicine person who was able to read the lab results.
Mm-hmm.
So I feel I feel good about that, but I don't feel like I really got any difference in quality of care, even though the specialists are a little bit different.
Yeah, yeah. And then in KL, we did get to see a nutritionist and a dietitian, which I was kind of hoping we got to do this time too, because as vegan vegetarians, we're always concerned about, are we eating a well balanced and how does that play out in our blood work? So getting a chance to talk to somebody about that would have been good. Although I think it was the internist did say that we were deficient in a couple of different vitamins. So, and here in Fethiye, they told us we were deficient in a couple of different vitamins. So I think we were able to get that information in a different way. Right. Okay.
Yeah.
Do you want to take a look at the lab test?
They're really virtually the same, really comprehensive. And not only were we just doing, a complete blood panel, but they were also looking at cancer markers and lipid panels. So they're looking at, liver function and kidney function.
And I really felt like with this battery of tests and the specialist on this particular in Fethiye, as a menopausal woman, I was really interested in my TSH levels and my thyroid and my hormones. And I feel like I got some really good results back from our visit here in Fethiye that were a little bit better than the ones they were in KL. So
yeah, and I certainly had
and I even got a thyroid ultrasound, which I had not had before, so that was good too.
Yeah.
And then also back on the menopausal part of it, women really worry about their bone density because that's something that really fades as we get older. And in Kuala Lumpur, I did get a DECA scan. So fortunately, they told me my bones were going to last me till I was 110. So I didn't feel like I needed to have another one here in Fethiye, but it was not offered here in Fethiye either. So that was nice to get in Kuala Lumpur.
Let's talk about the money and how much this costs. Because again, we saw 8 different specialists, complete lab work, an entire full day from one test and one exam to the other. It must have cost $1 million, right?
Right.
And put this in perspective, we do have health insurance. We can share another video with you about the health insurance that we have. But this is something that we just paid for out of pocket. This is not necessarily a wellness check.
Right. So we paid for the wellness checks out of pocket, but the extra specialists that we need to see, those we can submit to our insurance and get refunds or rebates from Ginkgo. We're with Ginkgo right now on that. So the specialist referrals, we will get reimbursed through Ginkgo. So our big numbers. So at Kuala Lumpur, we paid for Steve $425 and for women $480. There's a women's tax in Kuala Lumpur. And then Steve had to get an additional echocardiogram and I had to have an additional ophthalmologist test for a total of $1,059 for the two of us. So the specialist cost $77 a piece.
Let me just say that was 2 years ago. Yeah. I went back to their website and verified their prices have not gone up in 2 years.
That's fantastic.
So the prices are
can't
the
say
same
that about
today.
U.S. medicine.
But again, they list their prices on their website. So go figure.
Then for our numbers in Turkey, the numbers were a little bit different. So Steve's exam was $746, as was mine. So no female tax here, which is nice. And then the specialist, he also had to get a carotid artery sonogram or ultrasound. And then I had to also go back to see the ophthalmologist. So, and those were both $92 a piece. So our total out of pocket was $1,676, of which about $200 or so will be reimbursed by our insurance.
Right.
So $1,100 at one place, $1,600 at the other place. We still think that is huge value for us. There is no way we could do this in the U.S. We couldn't schedule it. Even if we could schedule it and get 8 specialists, I can't. You put in the comments how much you think that would cost if you could do it in the U.S. and would you do that in the U.S.? We do want to add that we did get some vaccinations in Kuala Lumpur. We needed to get some travel vaccinations. We had yellow fever and so on that we got done. We had 3 or 4 done. The price was $158, which doesn't really tell you much because we don't have the breakdown about how much each one was. So we apologize for that. But you can go to the Kuala Lumpur website and see how much those vaccinations are if you need to get your travel vaccinations. So which one would we prefer? I felt like the Kuala Lumpur experience was a little bit more professional. The hospital was more modern. The equipment was more up to date. And nothing was out of date anywhere. It just was more up to date. And I feel like the fact that everybody in Kuala Lumpur, all the staff spoke English well, which just, not that I have a fear of not being able to communicate, but it just brings the anxiety down a little bit when you're talking about your medical care and you're talking directly with the doctor rather than through an interpreter. I felt that was much better in Kuala Lumpur. We're trying to do apples to apples. So if you do apples to apples here, Fethiye comes out as more expensive. If you really kind of get into exactly everything we did, we saw more specialists in Fethiye. We have more testing in Fethiye. So it probably, if you could line item each item, it's probably about the same price. I mean, you're maybe splitting hairs on differences on prices. But for me, if I had to recommend one facility over another, I would recommend the Princess Court at Kuala Lumpur. What would you recommend?
I'd have to agree with you.
Okay.
I do think because it was a larger city and a very modern hospital in Kuala Lumpur, I think that is would be my choice.
And if you had a more difficult case and weren't just doing wellness, you certainly want to be at a larger hospital with more facilities, and that definitely would be in Kuala Lumpur at Princess Court.
Right.
Princess's Court. Princess with an S Court.
I don't think that. I think it's
Princess
Prince.
Court. Or
I
maybe
don't
it's
think
Prince
it's a female
Court.
at all.
It's not. No, it's Prince's Court. It's the apostrophe without an apostrophe.
Just Prince.
Oh, I don't know.
Just think of, Purple Rain.
And on that, we'll see you next week. Thanks, everybody.